For anxiety disorders, I'm going to go over the intervention, prevention strategies, and treatments. So let's start with self-care. All right, so to help prevent anxiety disorders, avoid alcohol. Alcohol might be harmful and aggravate certain conditions. Reduce caffeine intake. This one's pretty big. I know a lot of people really like their caffeine. So reducing your caffeine reduces your risk of aggravating certain conditions. Physical exercise, so aerobic activity, things like running, going to step class, playing basketball outside, things where you're getting your heart rate up. 20 to 30 minutes, 5 days a week, improves cardiovascular health. Stress management, that can help prevent anxiety disorders. So pursue an enjoyable activity or verbalizing frustration to reduce stress and improve mental health. So find something that's enjoyable to you, something that relieves stress, right? For me, I like to go frisbee golfing. That's something that relaxes me and it helps manage my stress. Quitting smoking, so stop smoking tobacco. Use relaxation techniques, deep breathing, taking a deep breath. That's something I use with my students all the time. If their anxiety's acting up and you can tell they're stressed out, just calming them down with a nice deep breath. It really does work wonders. Meditation, yoga. I know a lot of people that use yoga to relax, reduce stress, and reduce anxiety. Rhythmic exercise and other activities that reduce these symptoms of stress. And a healthy diet. So getting those essential nutrients and an adequate amount of calories, while avoiding things too much sugars, too much carbohydrates, and fatty foods. So eating that healthy diet is going to help prevent an anxiety disorder. Let's go into therapies. So cognitive behavioral therapy, that's one form of treatment. Talk therapy, it's a talk therapy that focuses on modifying negative thoughts, behaviors, and emotional responses associated with psychological distress. Meditation therapy improves mental health and helps with relaxation. And psychotherapy. So it's treatment of mental or behavioral disorders through talk therapy. That can help as well. Now let's go over the medications. So selective serotonin reuptake inhibitor, abbreviated as the acronym SSRI. This eases symptoms of depressed mood and anxiety. Anxiolytic, it relieves anxiety and tension, and it may promote sleep. Antidepressant. Let me go back. Let me say at least a few of the drug names. So selective serotonin reuptake inhibitor, sertraline, escitalopram, and citalopram. Those are good SSRI that are common drugs for that, and those ease the symptoms of depressed mood and anxiety. Common drugs that are anxiolytic, that relieve anxiety and tension. Diazepam, buspirone, those are the two most common. Antidepressants prevent or release depression and elevates mood. These are common, but I have heard a lot of negative things involving antidepressants. I do have a good buddy who takes antidepressants, and the effects can differ on person to person. So common antidepressants are venlafaxine, duloxetine, and amipramine. Sedatives are another drugs given as a form of treatment. These cause drowsiness, calmness, and dulled senses, and some types of these can be addictive. So I'll list some of the names: diazepam, lorazepam, clonazepam, oxazepam. Nerve medication pain. These block pain caused by damaged nerves. These can be a form of treatment. Venlafaxine, duloxetine, imipramine, which I mentioned before, desipramine, clonazepam, pregabalin. These are all different types. Now let's go into specialists. These are people that somebody suffering from anxiety disorder might see. So a clinical psychologist is the first one. These are people that treat mental disorders primarily using talk therapy. So they're going to try to talk with that person. Psychiatrist treats mental disorders primarily giving them a medication. And a primary care provider is going to help prevent, diagnose, and treat diseases. So let's go into some other ways. These are, I talked a little bit about some of these, but I've read an article on Healthline that has a few additional techniques. So eating well, which I mentioned, stress reduction, so taking walks regularly, joining an exercise class or gym, and practicing yoga. Those are key. Trying to identify it early as possible and getting an early intervention can also be key. Keeping a journal can help. So no one knows you better than you know yourself. So track your moods, your stress, anxiety. Maybe write down what's been working that day, what might not work the other day. Avoiding unhealthy substances, like I mentioned earlier. Staying away from drugs, tobacco, and alcohol. Those are key as well. Let's talk about when somebody that think they might be suffering, when they should see their doctor. So if you feel like you're worrying too much and it's interfering with your work, with your relationships, with school, with other parts of your life, that's probably a good time. If you have fear, worry, anxiety, and it's upsetting you, it's very difficult to control. If you're feeling depressed, having trouble with drugs and alcohol, or you have other mental health concerns, you should probably see your doctor. If you think your anxiety could be linked to a physical health problem, that's another time. And if you're having suicidal thoughts or behavior, you should definitely seek, or somebody with those feelings should seek emergency treatment as soon as possible. They should seek it as immediately.